All right, well, welcome everyone. Glad to see so many of you here tonight on such a beautiful day and really great topic. I'm really excited that that Christine is here and Dr. Perkins. Grateful that she's here tonight, and it's always such a treat to learn from her. We've only known each other for a couple years now, a little over a year maybe, but she's a wealth of knowledge, and it's really exciting to dig into essential oils in particular. So tonight we're going to learn from her about women's health and essential oils. And she's handpicked a few things that are standouts to her that she wants to teach about tonight. And when we wrap that up, we are going to do a really quick, fun make and take. So everybody gets to pick one homemade perfume, one perfume that they want to make. And I'll explain how that's going to work over here later. But what we're going to do is you can smell what we have here. I just made them up today, so usually you smell them more if they had a couple days to sit. But you can kind of smell them. So pick out which one, or maybe just by looking at the oils, you can kind of determine which one speaks to you, and you can pick out which one you want to do. And then over here, what we'll do is you'll pick out your roller bottle, and you'll pick out one sheet so you can see the ingredients, and then you'll come over here and you'll make it. So you put the oils in first, and then you'll add the fractionated coconut oil and grab your stickers, okay? But with that, I'm going to turn the time over to Christine. So glad you're all here. Okay. A win for housekeeping, just really quickly. Bathroom, just right here. There's also one at the very top of the stairs if you turn left. First door on your left. The water over here is infused with the Mother's Day oils. So we've got red mandarin, kumquat, and sunny citrus. Nice. So there's that, and we've got some veggies. So have at it. Thank you. Yeah. Here, I'm actually going to do this so you can see better.
Hi, everyone. Thanks for coming. It's a great turnout. I'm really glad to be here today to share with you my knowledge on women's health and essential oils. So we have a handout on hormones. How many of you know, I mean, every woman knows she has hormones, but how many of you know like the cycle that we're supposed to have, or how hormones fluctuate in our bodies? Most of us just know, we're having a hormonal day, or this is just sort of my time when my hormones are out, and those are actually probably really pleasant ways to term it. Our husbands and boyfriends may not actually term it that way. But hormones are natural. Hormone fluctuations are natural in a woman's life. Typically, we're fairly stable until we reach puberty, which is usually like a great childhood time when you have no hormonal fluctuations, and then we go through a period in puberty where the hormones come and go, and eventually cycles get regulated. Normally, when a woman is menstruating in her childbearing years, she should have her estrogen levels begin on day 1 to begin to elevate, and then by day 14 start to taper. Day 14, the progesterone levels start to come up and then start to taper, so they both drop off towards day 28, at which point she would have a period and shed the lining of her uterus and not be pregnant, and the cycle would begin all over again. And this cycle has big impacts on us. We actually feel this, not just physically, but we feel it emotionally. Hormones have a really big impact on women's health. So we're going to talk a little bit about hormones and how we can affect them using essential oils and other supplements tonight. But it's also really critical in a woman's life that we deal with sleep as well. So we're going to talk a little bit about sleep. Sleep really affects us emotionally and our hormones and can throw those off. So we'll talk a little bit about sleep. And then we might even talk a little bit just about emotions in general, because stress is perceived differently by women than by men. And I'm glad to see we have we've got one man in the audience who's counterbalancing all this estrogen. It's awesome. And so we actually have male hormones in us too that balance us out. We're a mixture of the female and the male hormones. And as we go through different stages in our life, those hormones are expected to change. As I said, puberty into childbearing years, into menopause, these hormones should exist in a normal natural cycle, and they do get messed up by our stress, by our lack of sleep, and also by pollutants and toxins that we have in our world. So we'll talk a little bit about that too. So how many people use the doTERRA products here tonight? Just so I know everybody uses them so far. Okay. I'm actually probably going to start off with Lifelong Vitality Pack, because usually I leave that to the end, but it's actually a critical part of health for everyone. And I recommend it to every single one of my patients, except pediatric patients. So mostly it's for my young adults, 15, 16 years old and up, that I would recommend the Lifelong Vitality Pack. What we're learning more about women's health in general is that it's actually the house that the hormones are in, rather than the hormones themselves, that we need to adjust. So we need to keep the body, the home that the hormones are in, healthy and effective, working like an amazing power machine. And then we'll age effectively. Our hormones will be conjugated properly. We'll have hormonal balance. But when those cells aren't functioning properly, when we don't have a good home, it's got some toxicity, some lack of sleep, et cetera, we start to see that the hormones go out of balance. So a lot of modern medicine uses hormonal replacement therapy for women, and that is like an end stage. Does anyone know anyone on hormone replacement therapy? Well, that's pretty good.
I was on it for years.
You're on it? Yeah. And it's been a common practice for medical doctors to prescribe hormones as women go into menopause, but it's also a common practice for them to prescribe the birth control pill. So many women have been on the birth control pill, and these are sort of exogenous sources of hormones that we don't actually need and can toxify us. And so if we make sure that the body, it's different for fertility. So if someone really needs to prevent a pregnancy, I'm not going to tell you that there are other ways that can do it just as effectively as the birth control pill. There are other ways to do it, but that's a totally different topic for tonight. But if we can take care of this house that everything is functioning in, then we will actually be able to have better hormonal balance in the long run and not need these hormone replacement therapies. They're the last resort, in my opinion. And they're because our bodies are so toxic and the cells are not functioning properly that we need to reach for those. And then the symptoms for women become unbearable. I don't think any woman should live through really terrible symptoms with menopause, which can be hot flashing, irritability, so some mood changes. There's a lot of skin and cellular connective tissue changes that happen as well. So women feel like they age very rapidly. And then there's bone health, there's bone loss, and there's cardiovascular things that can happen with menopause. So how many people are fertile? How many people are not in menopause? How many people cycle regularly? Okay, and so how many people don't cycle regularly? Like cycle but don't cycle regularly? Okay, and how many women are in menopause here tonight? We've got a few. So we're going to try and cover the gamut for everybody. So Lifelong Vitality Pack is this blend, these 3 supplements by doTERRA. Who takes them? Okay, good. I'm going to pass them around. The first one is a vitamin mineral complex that has a vegetable extract in it. It has everything that you need to support your cellular health. Alpha CRS is another supplement that has more antioxidants and potent cellular vitality, cellular energy supplements in there. And they are therapeutic dose, which is why I like them. Many times with supplement companies, they put small little amounts of things in, 10 milligrams, 5 milligrams, and you don't actually get any benefit from those. This company has designed this to have therapeutic value. So you have 100 milligrams of alpha-lipoic acid and 100 milligrams of acetyl-carnitine, which are both really powerful nutrients for your mitochondria. Mitochondria, it's the buzzword of today, are these little powerhouses inside your cells that make energy. And so everything your cells need to make good energy and clean house. So that's not only producing, vitality, but it's also cleaning up the debris and the toxins is in that supplement. And then you get your essential fatty acids in the third one, which essential fatty acids are really important because they're anti-inflammatory. And just about every condition is being related to inflammation. When the cells are toxic, the mitochondria don't work properly, they don't produce enough energy, they don't clean out the toxins, we create inflammation. So hopefully you can see how these 3 products put together actually give you good energy, all the nutrition that you need, combined with a good diet. Nothing replaces a good diet. So you can't just take this and then eat the standard American diet, in my opinion. We need to have a diet that's very highly based in vegetables with some, I am a believer that we should eat meat. I've never known vegetarians or vegans to actually be very healthy for very long. Like long-term veganism has never seen it in my practice. In 25 years of seeing people, I've never known it. So I do believe we need certain forms of animal protein, and that's pretty much it. Fat, nuts and seeds, fruits and vegetables, and meat, fish, and eggs. And I think you probably noticed that I didn't say sugar, and I didn't say grain of any kind. I didn't say rice or wheat or bread, pasta. We do not need those. Those are not what make us thrive. So that's kind of the diet combined with these supplements is what gives us a really good solid foundation to keeping this home that the hormones live in healthy, which will help us transition into menopause better. And I think that's why many women have aged well through menopause until now. Like I see more and more women with hot flashing, and I see more and more women with infertility. I see more and more women with irregular cycles, dysfunctional uterine bleeding, so they have heavy cycles or they spot or bleed in between. Lots of disrupted cycles, and I do believe it's partly because of the diets that we're consuming are messing with us on many levels. There was a study done called Pottinger's Cats, and they took cats and fed them a junk food diet, kind of similar to what we would be considered a junk food diet, but translated into cat food. And the first generation, which was our grandparents' generation, or my grandparents' generation, I'm in my 40s, did really, really well. Like they actually didn't get organ diseases or cancer or diabetes until well into their sort of 70s and 80s. And then there was my parents' generation, which they're in their like late 60s, early 70s. Those people started getting diabetes, heart disease, and other cancers and organ dysfunction long before, decades before their parents. And then the third generation is my generation, and a little bit younger. And the fourth generation, well, that's the younger generation than even me, and we'll tell you what they had. So the first generation mimicked all of this. The cats mimicked my grandparents' generation. They did fairly well on this junk food diet. Second generation, they actually started getting endocrine disorders and cancers and lots of dysfunction. Third generation, which is my generation, all of those disorders happened decades younger, or to cats, it might have been years younger if we translated into them. And then there was no fourth generation. They actually couldn't reproduce. And that's one of the largest things that faces my generation and the younger generation now is they have trouble getting pregnant. They have trouble staying pregnant. There's lots of miscarriages. And then we also see younger and younger generations going through menopause earlier. And I see younger and younger women going through menopause and having a much harder time than their parents, their mothers did, or their grandmothers did. And I believe it's the toxicity. It's because we're not taking care of this home. It can't detoxify. The cells can't function. So they get backlogged, and we get all this sluggishness, and we can't conjugate the hormones. We can't get rid of them, and they have a negative effect on us in large amounts because we're supposed to go through menopause. Many, many countries that have simple diets and simple living, the women go through menopause very, very easily. They don't have hot flashing. They don't have fatigue. They don't get irritable. They don't get sleepless. So we have a lot to learn from we're ahead in North America in some ways and developed, and in other ways we have a lot to learn from other countries on how to take care of ourselves and create stressor or less stressed lives, because we can't have stress-free lives. I don't think we can. So less stressed lives, and that we can eat healthier and take better care of ourselves. So that's the Lifelong Vitality Pack, and that kind of builds the foundation of having a really good body to help your body as it goes through all stages of your hormonal changes. All right, so next, I think I will talk about some different hormone balancing oils. So clary sage is a lovely oil. I love this oil. This is a great one. We were learning here last week actually about pregnancy and birth, and it's a great one to actually help get labor and contractions going, but it's quite estrogenic. So if a woman is low in estrogen, which can happen, and I don't necessarily think we should treat these hormone imbalances just symptomatology-wise. I do believe we should test our hormones. There's a urine test that I recommend my patients get called the Dutch Complete Urinalysis, and it's sent to the United States. I don't know if you can get it in some of the pharmacies like Cambrian Drugs and Script Pharmacy in the city here will carry some of these unique tests, and you can just do them yourself and send them off and have the results mailed to you. You don't need like a physician to interpret them because they interpret them for you. But having some sort of a baseline for your hormones is really important because lack of progesterone and lack of estrogen and lack of testosterone all have overlapping symptoms. Like low libido having a low libido can be one of all or all of those three hormones. And if I want to treat someone's estrogen, I need to know it's their estrogen. Why would I give them sandalwood, which treats testosterone, low testosterone, if I need to bump up their estrogen? So it's really important to test these. And if you don't have access to tests like that or naturopaths that can do it for you, I'd say start with your medical doctor and at least get some blood work done. It's not my favorite. It doesn't really give us an accurate example of what is being used in your body, but it's at least a basis for knowing what to treat because none of us want any extra hormones at all. If you look on the bottom of the first page, it talks about, so on the bottom left, it says if a woman has too much estrogen, mild phytoestrogens, which is what clary sage is what we're passing around, mild phytoestrogens can bind with the receptors of your tissues and have a mild estrogenic, if you have too much, it blocks it. Sorry, I'm reading the second one. So if you have too much estrogen in your body and you take these phytoestrogens in clary sage, then you'll block the effect of the other estrogens, which are more potent. If you have too little, this will bump it up. So you kind of need to know where you're at. Do you have too many? Do you have too little? What do we need to do here? Do we need to block estrogen and bump progesterone? Do we need to deal with whichever hormone it is? We have to know. And so testing becomes a really important part of what I do with my patients. In the Dutch urine test, you pee on some litmus cards 4 or 5 times a day. The 5th time is if you happen to be a nighttime peer and you wake up in the night. You take a sample then because we want a 24-hour picture of what's going on for you with your hormones. The test is about $400 though, no matter where you go. It's a pretty pricey one. Some insurance companies will cover it. But again, we have to know what exactly we're treating in order to get the best results. We can't just use even phytoestrogens or phytoprogesterones to help balance a woman's body if we don't know what we're dealing with. They can be harmful just as much as a synthetic hormone could be as well. And we just don't necessarily know that for sure. Like we don't have tests that say bioidentical hormones are just as bad for you as synthetic hormones, or estrogen-like plants are harmful for you. We don't have the studies for that. But in general, the rule of thumb is that if you don't need the hormones, you shouldn't be taking them, and you shouldn't have them. Okay? And if you are of childbearing years and you're messing with your hormones, you're shutting down actually a process in your body. Your body's very clever. If you are making too much estrogen and you take clary sage and give you more, your body is going to go, whoa, I don't need so much estrogen, and it's going to shut it down. So that can be regulatory. But if you do that for a really long period of time, you might suppress the actual ovaries function so that when you stop, you become dependent on even an oil, which you could do. So for me, therapeutically, we use these oils, and as symptoms change, we use different oils. No one stays on the same oil all the time, forever and ever, amen, and done. We have to evaluate where we're at. And so we retest the hormones even every 6 to 8 months to a year, somewhere in there, okay? So clary sage helps with estrogen, in my opinion, when we're low in estrogen. I don't tend to use extra estrogen to shut off or to bind the receptors to block estrogen. It is doable. It is on your sheet. You could do it. That's not typically the way I do it. Usually we have these extra estrogens in our body and we need to get rid of those. So I use supplements that would bind those and pull them out of your body. Most of us are actually over-toxified in estrogen because of the plastics that we have cooked in and drank from, and all of the other synthetic kind of chemicals. Even scent, like phthalates in perfume, can act like a hormone disruptor and an extra estrogen in our bodies. And extra estrogen is really unhealthy for us because it proliferates the tissue. When you know what the cycle does, you know, in that beginning day 1 to day 14, when estrogen starts to rise in a normal cycling woman's hormonal cycle, it's actually making the uterine tissue thicker. It's growing it and proliferating it. Well, we don't want to add that to breast tissue or ovarian tissue or uterine tissue if it doesn't need it, or if there's already too much, because that could potentiate cancer, and we don't want that. But things like endometriosis, painful menstrual cycles, missed menstrual cycles or too long of menstrual cycles, dysfunctional uterine bleeding can all be from extra estrogens in our diets, in our atmosphere. So we don't want to add too many. So I only use clary sage when I want to bring up estrogen, when I know estrogen is low. Okay, that one is very concentrated and on its own. We use the Clary Calm, which I'll talk about the rollerball in a minute, under other circumstances, and in which case it's diluted and it's combined with other balanced hormones, and we can use that for a little longer. Okay, so the next one is thyme oil. Thyme oil is not my favorite smelling oil. I'm not sure. My mom is here in the audience tonight, and she can attest to this. I never really liked cooking with thyme either. Like, we put thyme in a dish and I'd be, oh, that's so yucky. This is progesterogenic though, and I could use the progesterone. So this would be another example of where you smell something and you think you don't need it because you don't like it. I could have used that in my lifetime. So thyme can boost the progesterone in you if you're deficient, if you're luteal phase deficient, which means your second half of your cycle is too short. So those are the women that are getting periods like every 23 to 28 days, so their cycles are too short. Those would be the women that need more progesterone or more thyme added to their cycles. Some women that can get pregnant but not keep the pregnancy are also deficient in progesterone. And then, progesterone is actually very safe. The human fetus produces up to 400 milligrams of progesterone a day. So to add progesterone or progesterogenic-like herbs into your routine is not as harmful as estrogen. Estrogen is the one that proliferates and makes the cells, replicate themselves, and they might be bad cells, so you increase your risk for cancer, but not so with progesterone. And then the third oil that I use to balance out hormones in women is sandalwood. And so sandalwood, I actually really like that one too, though. That's one of my favorites. It's great for testosterone. So men and women can use this to boost their testosterone.
Indian or Hawaiian?
It's just their straight sandalwood. So that's the Indian one, and it's not the Hawaiian one. I know that for sure. Yeah. And so libido is a big thing for my patients. Come to me and they have low libido, and we do their hormone test, and they have low testosterone. Many women have low testosterone. This can help to bring up testosterone. But so can Olympic deadlifting. So I like to suggest exercise as a really important way, because it does, if you should be out there Olympic deadlifting, it's really spectacular for women to be doing this. Historically, if you look at Primal Man, we didn't do these long cardio workouts. We didn't do these, 4-hour runs. We ran in a sprint to survive being attacked or to catch our prey. And we lifted heavy things. We lifted boulders and trees to make our homes. And we slept better. And we had our hormones last longer. We reproduced better in those day and ages. Now, mortality was pretty low back in the primal day. Like, we might have only lived to be 30 years old. I think the average was 33. And so it was usually disease or childbirth that killed us women. That was actually the leading cause of death, was childbirth for women for a very long time, up until even the early 1900s. The leading cause of death for women was childbirth. So it can be dangerous, but we have a lot of things in place nowadays that make it less dangerous, and we can live longer. But anyways, these were the things we were doing, and our hormones were in balance, and we were healthy. So Olympic deadlifting, even full body chin-ups, so doing chin-ups and negatives in your workouts, doing sprints every once in a while, and going on longer hikes. This is the way we were meant to move our bodies. We actually walked apparently 16 kilometers a day was the average man's walking per day. So we need to move our bodies to be healthy, and that's another part of keeping our hormones balanced, okay? So then we move into the idea about this Clary Calm roller ball. This is one of I love this. I use this all the time myself. Amy, is Amy around? Do we have one that's open? It's just I've got a box here and I don't want to open it. Yeah. So this is a blend. It's on the back side of your paper. It actually tells you everything that's in here. So I adore this oil. And the reason I like this oil is because it affects so many things. It affects your hormones, it affects your mood, it affects your stress levels, and it helps you sleep. Look at all the different oils in that blend. And it's like they figured out, it's like doTERRA, the medical advisors figured out what oil could a woman possibly need for any time in her reproductive history, and they put it in here, right? So there's a lot of emotional oils that are in this roller ball, and the emotional oils help us cope with our stress. So stress is one thing that robs our reproductive cycle. So you probably heard of women being in a war. A war happens and women lose their cycles, or there's a massive stress and a woman loses her cycle altogether, or extra exercise and she loses her cycle completely. These stresses borrow the hormones off of the reproductive cycle to be shunted into stress hormones, because cortisol, adrenaline, the fight or flight hormones are critical to survive. Reproduction is secondary. So it's kind of put on the back burner, and the body borrows the other hormones to make the critical ones. But that's kind of what's happening all the time with us now. We live in these low-grade states of chronic stress, and we're chronically borrowing the hormones off of that cycle and depleting ourselves. And so if we can reduce our cortisol levels and reduce our stress levels, our hormones can remain normal, and we can have normal reproductive cycles. So this is not only a way to give yourself a little bit of estrogenic or phytoestrogenic and phytoprogesterogenic, because there's Vitex in there as well as progesterogenic, but it also helps you deal with your stress and calm your body and give you peace and quiet and relaxed state inside your physical body, which then brings down, or is a sign that those hormones, those cortisol hormones, have been brought down, and then we won't be pulling off the reproductive cycle. As women age and go through menopause, so I kind of talked about how you could skip your period if you were under stress. But if you happen to make it to 60 years old and you've been under chronic stress, your adrenal glands, which are the stress organs, are supposed to pick up where your ovaries and your uterus leave off. They're supposed to produce these hormones for you. If they're already sapped and depleted from overuse or from years of chronic stress, which I have to say, my experience is that life just gets more stressful. It doesn't get less stressful. It's different stress, but we go through a lot more grief and loss and decline and illness as we age, which is totally different stress than a wedding, a new baby, sleeplessness. Like, those are kind of some of the happier times in our lives, but as we age, things tend to decline a little bit. So we need to learn to deal with our stress better. We need to have our stress organs, our adrenal glands, functioning even better than than the way we've got them today. Anyways, living in these low-grade states of chronic stress. So it's important to manage stress, and Clary Calm, the rollerball, is one of the ways to do that long-term that is very effective and very safe and will not disrupt your hormones that dramatically. And I have women that have hot flashes, menopausal hot flashes, and that is all I do for them. And all of a sudden they stop. Completely gone, sleeping through the night.
My mom needs them.
It's actually, and I have them roll it from hip to hip. So low across the abdomen, like right over the uterus and ovaries, hip to hip and back. So 2 strokes, back and one and then back again. Morning and night is all I have them do. It can be that simple. And
Really?
Yeah. And they feel calmer. Has anyone used it in the room? Has anyone used it in the top of hot flashes?
No.
So my mom maybe has a story to tell. So, but I have many, many patients that we've used this for, and they find it useful. But it also helps with the hormonal imbalances that come with PMS. So PMS, there are many different versions of PMS. There's the cravings, the depression, and the bloating versions. This helps with each one. Each one, it can balance out hormones. It doesn't matter what kind of PMS you have. The Clary Calm Rollerball will help with that.
And you would put it in the same
way. And then throughout the day, let's say you're using it just because you're super stressed and your hormones are out of balance. That would be, I'd use it through the day, and I'd use it on pulse points. I use it to help bring my stress down for the emotional stuff, but I use it on pulse points for that, versus here I want it directly over the uterus and ovaries.
And every day.
Every day and night. So if a woman is in menopause, I'd have her do it twice a day. For women who have PMS, I have them do it from day 14 to the first day they bleed, only at night. So we sort of mimic the cycle. We give them a little bit more progesterone and estrogen when it would be high, day 14, and then at day 1, when the bleeding starts, we taper it right off, we stop it.
And sorry, when you said you'd put on the pulse points for emotional?
Yeah, so if it's just emotional stuff that you're dealing with, for women in particular, this blend is beautiful. I think that's why they called it very calm. Was the calm aspect of it helps soothe our emotions.
And then just as needed? Or?
As needed. Yeah, I often get asked about that with oils, with how often to dose with oils. And they are very potent. We teach that, right? We talk about 1 drop of peppermint being equivalent to 28 cups of tea. That's pretty potent. But our bodies also clear the oils very quickly and metabolize them very quickly, so we need to apply them more frequently than you would think. And there's no danger in that. They're not like medication or pharmacy. They might have certain components that are similar, but because they work naturally within your body knows how to detoxify from them as well or clear them. And so it does that very quickly, very easily. You may need to apply them more than once or twice a day.
I was going to say too about the Terry Calm. My daughter takes, she very bad menstrual cramps, and
Yeah.
she takes Advil many times throughout. Anyway, so I got her the Terry Calm, and she said this is the first time she's had her period, and she didn't need to take any Advil, and just using the Terry Calm on her abdomen. So for her to say that, that's pretty impressive.
Yes. And that's a big thing too. I mean, how many of us take Advil and Tylenol and things like that for our periods? The period should actually be almost a non-event. Like how it should be versus how it is on average. Like the average period is between 28 and 32 days. There's some pain on the first couple of days. The first day is a little heavy, and it lasts 7 to 10 days. That's the average. That's what people call normal. That is not normal. Normal is you ovulate with the moon, the full moon. Normal is you begin to bleed at the new moon, and you have no pain. It's moderate flow to light flow, and it's 3 to 4 days of bleeding, and it's done. And there's no breast tenderness. I almost said the other B word. There's none of that either. Your mood changing. We'll keep it clean tonight. There's no emotional changes. There's no cravings. There's no bloating. There's none of that stuff going on with your period coming or with the period. There's no headaches, no migraines, nothing at all. Well, the invention of this light bulb above me is part of the problem. The incandescent light really changed how we cycle and changed our pituitary glands and how they release the hormones that are supposed to be released that trigger the ovaries to do what they're supposed to do. So when we actually have women that are out of sync with the moon and they want it to be back on the normal, like a real normal cycle, I actually have them leave their bedside lamp on the day before, the day of, and the day after the full moon. And they sleep with the light on, and it actually mimics the full moon. Or if they can have completely darkened rooms without lights outside, then I have them sleep with the blinds open and get exposed to the full moon, and then that gets their cycles back on track. But most young girls, I can't tell you how many young women since I was a teenager get put on the birth control pill to regulate their periods. Like getting periods regular and having a cycle that coordinates with the moon is like ridiculous. That's witchcraft. But that is how we're physiologically designed to be, right? So most women,
every woman in the world would cycle at the same time.
Yeah,
that would be kind of scary.
Yeah, but remember,
The world would implode.
the full moon here is not happening in the full moon in another It does shift. Exactly. But remember, it's a non-event.
Yeah.
There's no emotional. If we had to do what we do now all together, then it would be a problem. Right? And we all went through that cycle, and that actually does happen.
Yeah. Well, my 2 teenagers cycle at the same time as me, and my husband hides for that.
So it doesn't have to be that way.
Yeah.
It really doesn't. But we have to look at cleaning our lives up, right? These are the excess hormones that drive us to do this. In fact, it's not until some of my patients come off of the birth control pill, because they often come to me and then we'll talk about how attached they are to the birth control pill because it's wreaking havoc in their lives. They're gaining weight, they're depressed, they hold fluid, they've got irritable bowel, and all of it is because of the birth control pill. And when they come off, it's not until they come off that they go, oh my goodness, I never realized I'm actually sane. They would get totally ballistic angry on the birth control pill for several days of the month. And it's the excess hormones. The birth control pill is a really dramatic example, but in general, that is what happens because we're so over-toxified as a population. We have so many of these extra hormones, we all behave almost as if we're on the birth control pill when we're not. Which brings me to tap water.
Uh-oh.
So tap water is like a really big problem. How many people, okay, so how do you think you eliminate your drugs that you take? How do people eliminate drugs that they take? They pee them out and they poop them out. 72 hours after you flush that toilet water, it winds up back in your drinking faucet.
Okay, thanks for that.
It has no bacteria, it has no poop in it, it has no bad stuff like that in it. But the municipal facilities have no filters small enough to remove the drugs. So if all the female population that we know of, this huge population of young women are on the birth control pill, and then we've got another group of women on hormone replacement therapy, and then we've got everybody else in between. 50% of the Canadian population is actually on a mood-altering substance to help with their anxiety or depression. So you're getting a little cocktail every time you drink tap water of Lipitor, Prozac, Zoloft, birth control pill, hormone replacement therapy, you name it, blood pressure medications. It's all in your tap water in a small little cocktail. And that is not only confirmed through scientific, like there have been people that have gone and tested it and revealed the results. I actually have a patient who is a water treatment supervisor, and he won't even drink the water because he knows it's loaded with drugs.
So what does he do?
He's supervised. Oh, what does he do with? I thought he drinks reverse osmosis water, which is what I do. Reverse osmosis water that you remineralize.
What if you boil it?
No,
That doesn't do anything.
that actually concentrates it.
Oh, great.
So distilling is like boiling, but then you catch the distillate as it boils and the steam comes off, they condense that. But many of those drugs actually have a boiling point lower than water. So as the water's coming to the boil, the drug evaporates off and comes into the distillate that you drink. So distilled water is no better than boiled water. Boiled water will get rid of the bad bacteria or stuff that's in it that's like cause sickness, but it's not going to, it's going to concentrate the drugs.
Well, how do you remineralize?
There are a couple of products that I use called concentraces, is one of them available at the health food stores or Cell Food, I like that. And there are some other, it recently was told about some reverse osmosis filters where they actually are included in the final stage of the unit. They do a remineralizing process. So you just have to check with the different companies. And see what you can find. Okay. So, what you're hearing tonight is that we have a lot of hormones in our systems, too many, in fact, and too many of the wrong kinds. We need to detoxify from them, and we need to protect ourselves from them. And we can do that with the Lifelong Vitality Pack, does that for us, as well as use some of these essential oils, either to build our hormones or block the negative ones from working. But ultimately, we need to detoxify and get those negative hormones out of our bodies, those exogenous hormones, those hormones that are toxins out of our bodies. And when I say toxins, I mean like chemicals. Okay, so then the other thing that I'll talk about is sleep. So sleep is like critical for women and our hormones. They really disrupt, having a lack of sleep really disrupts our hormones. And the Serenity blend, the Restful blend, and the Serenity gel caps are wonderful for helping women get good sleep. Now, if you're not getting good sleep because your hormones are off and you're getting hot flashes every night, this isn't going to cure that. But the Clary-Calm will. You would use Clary-Calm and you would use these to help you sleep. These, I find, if I actually have a bath in the Serenity, I can hardly get out of the bath. Like, I am so asleep and heavy and ready for sleep. It's sedated my nervous system so much that I can crawl into bed and drift fast to sleep. But typically my routine is to put a couple of drops on the soles of my feet and to take 1 or 2 of these per night. I only need to take 1, and some women need to take 2. I've had some people report when they take 2, they get a little bit wired and for a couple of days, and then it regulates for them, but I only need to take 1. And the supplements that are in here are very sedating to the nervous system. The lavender in here is very calming to the nervous system, but there's also L-theanine, which is a known supplement to help us turn off that active mind. So most women are worriers. That seems to be in our nature. And I'm not sure if, I'll pass this one around because this is absolutely beautiful. And you can also use the Serenity blend in the daytime. I wouldn't use a lot of it because it, like for someone like me, it might put me to sleep. But if I'm really stressed about something, a couple of drops on my pulse points and have a nice deep inhale, and I will calm right down. Because mood is actually chemical based. And I told this story at another class that I did, and I see some familiar faces here. But when I smell polo, I'm catapulted back into grade 8 and dancing to Stairway to Heaven, right? Like I smell that scent and it takes me, and it's a good memory for me. My cats had a fungus a few years ago, and we had to douse everything in tea tree oil.
Oh.
Now I smell tea tree, and I have like this negative, that time. I remember bathing 3 cats twice a week. Right? So it's this guttural thing for me. So scent can really affect our mood, what we think, and then also that affects our hormones long term. So Serenity can be used at night to help you sleep, but it can also be helped to calm you down when you've had a high stress.
Can you use it, the couple drops on your feet before spring while pregnant?
I dilute it if you didn't know if you were sensitive to the oils, like if your skin was sensitive, and I probably only used 1 drop. And I used caution. In pregnancy, it's really use common sense and use caution. Your pores absorb 56% of whatever you put on them. So it will get into your bloodstream. But your placenta is like a great guard keeper. It's like a locked down moat, and it won't let a lot of things cross that border. You'd have to take a lot of essential oils to really affect that placenta. But each person is an individual. And I certainly would be cautious also nursing and breastfeeding postpartum, bathing in that. Like knowing my experience, especially if you're sleeping with your child, I'd be cautious to sedate myself so much. And also just in those first few days postpartum, not later on when your milk is established and you're used to sleeping with your child and that kind of stuff. You can be pretty groggy in those first few days, especially if you've had epidural or you've had other drugs postpartum. You want to be careful with sleeping with the baby. But that'd be the only caution I'd have.
Are these soft gels fine, like long term? Because I've ordered those for both my mom and others for their Mother's Day, so can they continue to use it?
Yes. And I wouldn't do the soft gels in pregnancy. I'd do lavender, but I just wouldn't take the soft gels in pregnancy. You could take lavender internally. Mm-hmm.
Do these work for men, or can they be used?
The Serenity?
Yeah.
Yes,
Okay.
totally.
But the
Clarion Calm roller ball. Sorry?
The capsules?
Yeah.
Okay.
They can be used there. It's sort of a companion product to the oil. My partner and I put oils on our feet at night. We do frankincense and Serenity and talk about the things we're grateful for before bed. And then TV kind of goes off and we take our capsules and melatonin and off to sleep we go. That's sort of our routine.
And the melatonin?
Yeah, we do melatonin too. Melatonin is actually a really brilliant hormone. And it so declines as we age. And it's being shown to be anti-cancer, antioxidant. It's hugely important. And there are medical doctors in the United States that are prescribing between 100 and 180 milligrams a day. I take 5 if I'm lucky. Like I take between 3 and 5 little sprays under my tongue. So you can take quite a bit of melatonin and it is very safe. And like I said, it acts way more in the body than just for sleep.
It doesn't work for me for sleep.
So then sleep might be something different for you. It might be more of an active mind than low melatonin, right? In which case GABA might work more and L-theanine might work more.
Okay.
Mm-hmm. GABA is awesome for shutting your mind off.
Yeah. So some people are groggy by it, and that's a sign that it's not for you. It's a sign you're taking too much and you don't need it. So in that case, there are other hormones involved in sleep, or neurotransmitters, we should probably say, that are involved in sleep. Magnesium is a mineral that is really important for relaxing muscles and sleep. So it could just be that you need some muscle relaxing that keeps you awake, twitchy feet or restless legs.
Have a bath with
I
deep
honestly
blue.
don't have So I was advised, to try and feel more restful after even a short period of sleep. To try, when I have only 4 or 5 hours to sleep, try and wake up more, alert and stuff. And it had a completely opposite effect.
So you know what the source of the problem is. You just told me it's not enough sleep.
Yeah, and I know,
it's not that you're melatonin deficient.
At this stage of my life, I can't change it.
Yeah.
So it's something I have to deal with, but it's not something I can deal with.
Right. And so until you can give yourself the adequate time, which is between 6 and 8 hours, minimum 6 hours. If you're sleeping less than 6 hours, you really ramp your risk for disease up really, really high. So minimum 6 to 8 hours. And when you can give yourself that, if you're still not sleeping well, then it might be a melatonin problem. But when you know it's just because you don't get to bed at an early enough time or you've got that short period of time, no amount of anything I would prescribe for you or oil will help you feel like you got more sleep.
Yeah.
Like I can't warp time. I wish I could. How many of us wish we could have 26 hours in a day or 29 hours in a day, right? Yeah. And I do several hours before I go to bed, and also while I sleep sometimes. No, not just topical. I use it in multiple different ways.
Magnesium. Can you overdose on magnesium?
It depends on the type of magnesium. It comes in many different forms, and if you did, you'd have diarrhea. So you typically, magnesium is one of the least absorbed minerals that we can handle in our bodies. In fact, the highest absorption from magnesium bisglycinate is 4%. That's all you absorb out of your capsules that you take. It's that hard to absorb. So you could take quite a lot of it, and it's not going to be absorbed into your body. It is what most North Americans, 90% of North Americans are deficient in that, and not calcium. We're way over
If I don't
calcified.
take calcium and magnesium tonight, I have really bad nightmares all night long. But I just was afraid to up it from the 400 milligrams or the standard magnesium capsule.
So if it's magnesium hydroxide, which is what most capsules standardized are made from, that is a laxative in naturopathic medicine. I don't use that for anything other than to give people a bowel movement.
Oh, okay.
So if you wanted something that is absorbed, you take magnesium bisglycinate or magnesium glycinate.
Yeah.
Is the best absorbed form. And then citrate and aspartate and the other chelates is what they call them, fit somewhere in between there.
Okay.
But yeah, and calcium carbonate as well. So here we get onto a nice calcium discussion, because I do quite like the bone nutrients supplement here, but I don't like calcium in general. So if someone is osteoporotic, we have to look at their vitamin K levels, which I believe are in here. They've got vitamin K. No, it's D's. Vitamin K would have to be added to this, but it's in the Lifelong Vitality. You might need a little bit more, because vitamin K is what helps you deliver calcium into your bones, and the vitamin D. They're all three required. But we are a way overcalcified society. For 20 years, I've known people taking calcium carbonate. Do you know what calcium carbonate is derived from?
Limestone.
Limestone. Who can digest stone? Do you know any humans that digest stone? I don't at all. You'll absorb it, but your body goes, I don't know what to do with this. What am I supposed to do with this? And it plaques it out. It gets rid of it. It gives you kidney stones. It gives you gallstones. It gives you hardening of your arteries. It calcifies in your pineal gland and interferes with your hormone balance. Your master glands are your pineal and your pituitary gland. It plaques out in the brain. And so we've got this way overcalcified society taking more calcium and drinking their milk and doing all these things to get calcium, when that is not what we need to worry about. So if someone is osteoporotic, then I would say reach for something like this. It's coral calcium. It's a little better absorbed, a little better used. You'd need some vitamin K with it, and I'd probably tell you to make bone broth. That was how human beings got their calcium. And of course, we ate the small digits off of creatures, which isn't usually a good topic for discussion. But we did. We ate the little digits off of creatures that we killed. We never let any part of the animal go bad. We skinned them and used their skin. We ate all the organs. We ate the small bones, and then we brewed, or we made a broth out of the other bones, and we boiled them down. And we got calcium that way. And that is bone-specific calcium. Your body knows what to do with that calcium because it came from bone. Okay? So yes, magnesium can be toxic, but you're going to only find it toxic to the bowel. It's not going, unless you took it IV, that is another way naturopaths do it, and it can slow your heart rate, like it can relax you so much that it can slow your heart rate, but I've never witnessed any problems with magnesium toxicity in my lifetime of doing this work. Okay, so last one as well is the phytoestrogen lifetime complex. This contains the soy isoflavones and genistein, which are both estrogenic. So again, in terms of how I would progress as a naturopath looking at people is I would assess the hormones first and find out what is low, what is high, what needs detoxing, what needs supporting. If estrogen was low, I would consider first doing the Clary-Calm Rollerball. That is the gentlest form of introducing or increasing more estrogen and progesterone. Then I would look at using just Clary Sage because it is more strongly estrogenic. And then if I still wasn't getting any success, I would add the phytoestrogen complex. And if that didn't work, then I'd probably be thinking about some other herbal medicines that I use that act phytoestrogenically. And then if that didn't work, I'd be sending someone to get some bioidentical hormones. But that's sort of the last stage.
So if you were high in estrogen, you wouldn't want to take that.
No. And if you're high in estrogen, typically I want to bring that estrogen down. So I use calcium D-glucuronate. It's an actual form of calcium that binds the estrogen and flushes it out the liver and the kidneys. So people who have like endometriosis or very painful periods, because that's typically a hyperestrogen state, I will use that to pull for 2 or 3 months to pull the estrogen out of their system, and then their symptoms will go away, like their body regulates itself better. Okay, but there are different, hormones are supposed to be like this. Estrogen and progesterone are supposed to be in balance. You can have excess estrogen, and it creates this disparity, right? You can also have low progesterone and create that disparity. So low progesterone can actually create the same symptoms of estrogen dominance as estrogen dominance can. But you might, and that's why we have to figure out which hormone it is that's gone out of balance.
Do you do that with blood work? I can wait, so I wasn't
Urine is my favorite. It's called Dutch urine complete test. It's considered the gold standard because hormones in your bloodstream are being transported. I like to say it's like a bus with people on the bus. So the people on the bus are the hormones that are being transported, and the bus is driving around your system, delivering the hormones to the organs. What they test in your bloodstream are the people standing at the bus stop. They don't actually test who's on the bus, how many people are on the bus being delivered to the organs. They're testing who's standing at the bus stop waiting, which is a tiny fraction of what hormone is available to you that you're using. It's very inaccurate.
And that's what they normally test for. Like if I go to my doctor for a physical, that's what they're testing for.
Yeah. Mm-hmm. Very inaccurate.
So
when you test the urine, I don't know that they'll do it. They might not even know to do it. Saliva testing has been used in the past, but the Dutch urine is even better than that.
What's the name of it?
Dutch, like a Dutch person, D-U-T-C-H, and then urine complete test.
Mostly done by naturopath, right?
Mm-hmm.
Yeah.
Or like I said, you might be able to find it in the pharmacy in Cambrian Drugs or at Script Pharmacy. Yeah, so that you can actually do them yourself and send them away, and they interpret the results and send it to you. You can skip the middleman. But it is kind of nice to have the middleman sometimes to interpret. We all tend to second guess ourselves. Even I need someone who looks at my health and tells me what to do. Because I'm like everybody, I can read the Modern Essentials and be like, ooh, I need some of that. I could use that one too. What one should I use for this? And I need someone to prioritize it and be objective and give me some guidance. So those are the oils and the supplements that I recommend using to balance hormones. And I think we've answered some really great questions here tonight. I hope everyone's gotten some good information. Oh, yeah.
I was just curious about the water. If you can, if it is important to bathe in the filtered water as much as it is to drink it?
That's a really great question. You can't bathe in RO water, in my opinion. It's way too expensive. For every glass produced, it actually wastes a glass as well. So it is a wasteful form of water, and you should use it for the precious internal functioning. However, one step further to go would be to take, to have a water softener put on at the source of your water coming into your house. It'll at least take the chlorine out. So a normal shower exposes you to the equivalent of 7 glasses of water's chlorine. You breathe that in through the vapors. Chlorine is really a negative chemical for us. It kills all the bacteria in our guts and whatnot. So there is no way to get the pure water unless you live in the country and you've got a cistern or your own well. Then bathing is easy to do. But otherwise in the city water, no, I would say you've got to have that water softener to start with. And then but your body will also, some of those chemicals are not transdermally absorbed. So you have to keep that in mind too. So you might be bathing in it, but they can't get across your skin. Your skin is actually very poor at absorbing things. Oils, however, it does very well with, and 56%, as I said, of what you put on it will absorb. But some of those chemicals are too big for the pores to get in. So I don't think it's as big of an issue as drinking it.
Steve, have you ever seen those little balls in your bath to filter it? Why do the water stores are supposed to?
I don't know if they'll do the chemicals.
It's not a chemical.
No, to get the chemicals out of the water.
Like
Right?
Prozac and all that.
Yeah, like all the drugs that are in the water. I don't know that they'll do that. But they might neutralize chlorine and the fluoride and things like that. So if there are no other questions, I'll stick around for a little bit. I hope you've enjoyed our talk today, and I might see some of you on Saturday. I'm going to be at the conference Saturday too.
Just one question.
Sure.
Can you use that for kids?
On their feet, for sure.
Okay.
Yeah, I wouldn't give the capsules to children under the age of 12.
But like, would you then use it for
The rule of thumb is that we always dilute the oils topically because we don't know who's sensitive or to what oil. For instance, I've been burned by cinnamon oil, and I know no one else that's been burned by cinnamon oil. In fact, my Julie and Kelly have never in 5 years known someone with a burn like I got from cinnamon oil. I would never have known. It just happened to drip on my finger and I got a burn. So you have to be cautious with some oils, like oregano and cinnamon would be the ones. You would not expect anything to happen with the Serenity blend or lavender, but they're sensitive individuals. So start diluting in a carrier oil. If it feels fine, then you can use it neat. And I'm good with, I have the roller ball of frankincense to make it easy on my feet at night, and then I just add a drop of Serenity to my feet. I add that to it. So each person is an individual, and you should have like a test patch whenever you're using neat oils. And I would definitely say cassia and oil of oregano. Do you want to add? And thyme.
Black pepper.
And black pepper. So anything super spicy, I would definitely put in a carrier oil first to know.
Can you put it in their bath?
Yes. Yeah, that's the one that I can hardly get out. I have to like literally get out of the bath and get into bed because I'm so grumpy. It's beautiful.
See, and I find every time I put oil in my bath, my skin burns. But I can put it on my skin. It's really weird.
So, well, a bath is hot and it's going to open up your pores and draw your circulation. And when that happens, it'll make the nerves more sensitive at the skin level. But for some individuals, that will happen.
The only one that I can use is the deep blue.
That is so funny because I'm sure I put deep blue in my bath and I had the worst bath ever.
I had the best.
I was
I've
so
done it like
hot
4
and
nights in a
cold
row
at the
now.
same time. It was like ridiculous.
See, that never happened to me. It's like, because I work a job that's very physical, so I'm so relaxed after though, I can't move. It's like you with Serenity.
Yeah. So that's the thing with the essential oils is that we're all different. The chemistry of the oils, like who wears Whisper? Does anyone wear the women's blend or Whisper? It smells different on each woman because the chemistry in our skin is different and it changes the scent of the oil. And so that's the same idea. The oils do have these medicinal properties to them that will be absorbed through the skin, but what they do on your skin or how you react to them might be a little individual. They're not like a drug that has like one effect and one effect only, and your body will get used to it and then become resistant to antibiotics or something like that. Essential oils work on multiple levels, have many different constituents, and they will behave differently in different people, but with a general idea in mind, like with a general function in mind. So lavender isn't going to be stimulatory for one person and calming to another. Lavender is always calming to the nervous system. It just depends on how calming. And for some people that are depressed, they actually need calming, and that's what changes it for them. And some people are anxious and take lavender and feel calm. So you can see
And you
how
can
it's
take
a
lavender
different.
when you're pregnant, you said too, right?
Yeah. Okay. Anybody else? Good.
All right.
Thanks.
Thank you
Thanks
so
for your
much,
attention
Christine.
today.
That was awesome.